Hi, it's Mary Ellen with IT in Canada, and I'm here today at Baycrest speaking with Terrie Tucker, who's the Director of eHealth. Terrie, thanks for taking the time to speak with me today.
Thank you for inviting me.
Terrie, could we start with a brief description of Baycrest and also with the business issue that you were trying to resolve with your implementation of Office 365?
Sure. Baycrest is a complex continuum care hospital, mental health, rehab. We have a long-term care facility. We have supportive housing. We're a center for research and innovation. And we focus on the aging population.
Yeah, and I understand that you are now a user of Office 365. What was your goal with implementation of Office 365? What were you hoping to achieve?
Well, the ultimate goal was around sharing. So in healthcare, we spend public dollars to develop policies and electronic forms and different applications. And we think that we should be able to share those among the healthcare community. So when you think about something like a policy that's well developed and discussed ad nauseum in any organization, and when you get to the end of it, you've got a really good policy, and then the next hospital down the road is doing the same thing. So it just seemed to make sense instead of doing a bunch of emails back and forth, or when you think about some hospitals that are maybe in more remote areas where they don't have contacts, we just created this cloud-based website where people can actually just go and upload and download these shared documents.
Okay, that sounds great. Can you talk in slightly more specific terms about what it was that you deployed and what it was that you built in your collaboration solution?
Sure. So the site itself was developed using Office 365 and Microsoft and SharePoint. So it's pretty much an out-of-the-box SharePoint website. And the intention is just a portal where people can subscribe and download a variety of different artifacts, whether it's documents, electronic forms, applications. There is a community of practice where people can go and, it's sort of topic specific, whether it's around privacy or freedom of information or something like that.
Yeah, so could you talk to me a little bit about the actual implementation itself, how you managed that? I understand from some of our other conversations that you had a team that worked together to create this solution.
Really, it was a team, and it was kind of fun. It was, we just sat in a room for a few hours, and the tool itself was so easy. We actually sort of did our brainstorming and our creation all at once. So it was a team of someone from Microsoft, and a consulting firm that we use, their name is Geriatric, and then a couple of us from Baycrest here. And we sat around the table and just sort of talked about what the content should be. Oh yeah, we want to be able to share documents. We want to be able to share forms. We want to be able to share applications. And so we just created those categories as we went along. And then when we sort of talked about what kind of documents, then we made up the themes as we went along. So a theme around privacy, around project management, the list grew longer and longer. And we just had somebody just doing the data entry right then and there, doing the creation of the website as we went along. And by the time we sat there for about 2 or 3 hours, we actually had a fabulous start to the application, and we're just building it as it goes along. And it's so easy. We do have a SharePoint developer here, but it's really easy to create new categories and to upload documents, and so it's been an amazing teamwork effort, and it was a very easy implementation.
Okay, that's fantastic. So were there any challenges? What kind of lessons did you learn throughout this process that you might be able to share with other organizations that were embarking on a similar kind of project?
Well, I guess one of the challenges is the whole, you can get bogged down in the bureaucracy and the what if discussion. So what if, somebody posts something inappropriate? And are you going to stop a project, or are you going to try and open it up? And so we decided to take the risk and open it up. And yes, it could be possible that someone would would post something inappropriate, and we can take it down if we have to. So far, everybody's been very responsible. We haven't had those sorts of things. Another challenge would be the more content you get there, the more you could get to a place where there's no standardization in terms of language. And so once again, we just thought, let's get it out there, let's start to use it, and if we need to clean things up afterwards, we can do it then. But let's get the ball rolling. I would say our biggest challenge is in content and marketing. You know, obviously that's not our core business. So we're a hospital. You know, our theory here was just let's just share things. And so we haven't done much in terms of marketing at all. And the value of this website is going to be dependent on having rich content and having it be dynamic and having new things go there. So I would say that's our biggest challenge, is just getting enough people interested in it and willing to post their own documents as well.
Mm-hmm. Well, I think if they visit the site, it will be appealing. I've had a look and I was really impressed what you managed to build. What about the benefits of using Office 365 for a project like this? I'm interested from 3 different perspectives. So how does it benefit Baycrest? And how does it benefit the IT department? And how does it benefit this community of users that you're trying to build with the solution?
Well, I guess because it's cloud-based technology, we would not be doing it at Baycrest if it weren't so easy and if it weren't cloud-based. We don't have the infrastructure here to maintain a website and to be thinking about all the security and the maintenance of internal servers and access, that sort of thing. So for us, the benefit was the ease of implementation and the very, very low maintenance components. At this stage of the game, our only real work is to create a new user ID when we get an application for a new user. So huge benefits in terms of maintenance and our ability to implement. And I guess I see the bigger benefit here is to the healthcare community. You know, that this is a site for people to share. It's very easy to use. It's very easy to upload and download. And for me, that's the biggest benefit here, is that we spend public sector dollars to develop things like policies and electronic forms, and I want to see those dollars well used, and I think that this is a great collaboration site for people to share and learn from each other. I guess another big component would be e-learning tools. So we spend a lot of effort developing really great e-learning tools, and a good example would be privacy. Privacy is pretty standard, our privacy practices across the healthcare sector. We had some challenges in our area where we have physicians who have privileges at multiple hospitals, and they would have to take the privacy training at each hospital, and they weren't really happy about that. So we agreed in our Toronto Central LIN to harmonize our e-learning modules, and if you've taken the e-learning in one and you can produce a certificate, you don't have to retake it in another. So now we have the e-learning modules posted here for people to download them and to enable this kind of harmonization, and it's an efficient use of people's time too.
Yeah, it sounds like there are enormous productivity benefits for the users. They don't have to spend as much time. Documents that they might need are in a central location, and they're exposed to conversations that they might not be exposed to otherwise.
Exactly. You know, and in hospitals, you know, we have the benefit of privacy officers and, you know, people with knowledge and experience, but in a lot of smaller healthcare organizations, they don't sometimes have those resources. So this way, it's a way for people to tap in to some knowledge that they wouldn't necessarily have had before. Another piece is around electronic forms. So using SharePoint, we've developed a number of electronic forms, and it's quite labor intensive to develop these things, but it's something that could easily be reused by other organizations. So there's a huge efficiency and cost savings if you can just use what somebody else has developed.
Mm-hmm. Don't recreate the wheel.
Exactly.
Thank you so much, Terrie. I really appreciate your sharing your experience with us today.
Thank you for asking.